Good afternoon, everybody. Welcome to the City of Toronto's COVID-19 media briefing for Tuesday, April 14th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen and Fire Chief Matthew Pegg, who's also the General Manager of our Office of Emergency Management. Mr. Mayor.
Thank you, Brad. Good afternoon. May I begin by offering my sincere condolences to all the families who have lost loved ones in long-term care, both in our city and across the province. These are heartbreaking losses. They are parents and grandparents. They are often elderly and almost always frail. And some of the circumstances in which people haven't been able to say goodbye have been very difficult to comprehend. I know when I lost my own father, he was unconscious, but I had a chance to go and say goodbye to him. And I can't imagine how I would have dealt with not having that opportunity. So I see the people talking on television, and I know that it's a very difficult experience for them, and we all feel that as people here trying to deal with all these various things, including what's going on in long-term care. I can tell you that in our daily emergency management meetings, I continue to ask every single day, because I think you would expect that we all would talk about this every single day. I ask whether there's anything more that we can do in the city's 10 long-term care residences in particular, but across the spectrum, to stop the spread of the virus and to try to save more lives. And I know that the staff in those homes, all of the long-term care homes, are doing everything they can to save lives right now and to keep people healthy, and I thank them for their dedication and for their courage. Dr. Davila will have an update on long-term care homes today as part of our update for you. We're also working nonstop to make sure that these long-term care residences continue to have the personal protection equipment, PPE, that they need to do their job, and we're advocating to the province for a rapid catch-up on testing, combined with the all-important quick turnaround of the results so that can be turned into action. Chief Pegg will have an update on the work of the Emergency Operations Centre on PPE as part of our overall update today. I asked our team for a full update on this most important challenge, and he will in turn provide a summary report to the public through the media. Now, while we remain laser focused on the public health emergency and making sure that we continue to provide the essential and critical services to Toronto residents, we're also making sure that we do everything we can as a city government to help residents and businesses get through this. I don't have to tell you that Toronto's main streets are absolutely critical to the success of our city. They're the backbones of our residential neighborhoods and an important component of the quality of life that we all enjoy, and we use them as a way of selling people on the Toronto experience, people and companies that we want to have come here to enjoy the quality of life we do. One of my greatest fears is that Toronto comes through this crisis and sees its main street businesses decimated, and our streets devoid of the activity that make our city's life in normal times so exciting and so fulfilling. And of course, these main streets and all of that activity keep the city healthy at the same time. With this in mind, city staff are working on developing a range of solutions with partners in the community, while also continuing to advocate for additional support from the provincial and federal governments to ensure that we don't lose our small business community. One of the interesting solutions that has come forward and launches today has been a new web platform called Distantly.ca. Toronto-based Distantly.ca is a free, secure community crowdfunding tool that enables Torontonians and Canadians alike to support their favorite local businesses during the time of crisis they are undoubtedly experiencing. These contributions help to alleviate some of the overwhelming expenses that these businesses have, like rent and payroll during tough times. And using the Distantly.ca directory, Torontonians can search for their favorite local businesses and securely deliver contributions in a few clicks. These contributions, less a small transaction fee, are then securely deposited into the small business's verified bank account in 2 to 4 business days. This free platform was developed by Buildable, a Toronto-based technology firm at no cost, to support Main Street businesses across Toronto and indeed across Canada. It was the brainchild of Susan MacArthur, a former partner at a venture capital fund, Daniel Spataro, CEO and co-founder of Buildable Technologies, and Mo Khatib, CTO and co-founder of Buildable Technologies. And the inspiration came as a result of two factors, they tell us. First, the Buildable team heard my call at a recent Tech TO event that asked Toronto companies, the tech companies of which we have so many and that were doing so well before this crisis began, to come up with ideas and put them forward to help our city respond to this crisis. On the health side or on the business side or just about anywhere else they could help. And secondly, the Buildable team was looking for ways in which they could give money to their favorite businesses and found this was something that wasn't all that easy to do. And so they've worked with the group of Toronto Business Improvement Associations to get that job done, to get it developed, and it has put it forward now with a 0% platform fee in order to get as many businesses as much help and get them all of the money, as it were. I'll just say to you that we need more ideas like this to help us protect Toronto's health, to protect its vitality, to protect its economy. And I know we have the smart people out there that can come up with things like this, and we're more than happy then to bring them to the attention of Torontonians so that they know that these things will happen. And I encourage stores in Toronto, which are often the ones, stores and restaurants and these small businesses on the main streets, to visit distantly.ca to sign up, because you can't receive a contribution from a Torontonian, from one of your neighbours, if you're not signed up. I should also say that some of the leadership of the city's Economic Recovery Group met today, earlier on this afternoon, and that the groups, which include a number of councillors and others, continue to make plans for a very successful and successful recovery and restart, hopefully soon. I think we're all hoping for that day to come as soon as possible. Now, our public health experts tell us that we're at a crucial time in the war against COVID-19. 3 weeks ago, we saw modeling that frankly scared me like not much else ever has. But those same projections also hardened my resolve to make sure that we as a team, working with everybody else we could, the other governments and right down the line, did everything we could to save lives and to stop those projections from becoming true. We have to keep at this in order to stop the spread of this virus in our community. And it means, uncharacteristically for us in Toronto, staying home, and it means staying away from other people. This is the advice of our medical professionals. It is advice they don't give lightly, and we shouldn't take lightly. I'd love to wake up for tomorrow and for us to be able to turn some kind of a switch or flip a switch and just have our lives back to normal. I know you all would like that, but that is not possible. It's going to take time. It's going to take the efforts of everyone, and I think everybody's getting on board now. The vast majority of you are helping to flatten that curve. You are, in turn, actually saving lives, and your city thanks you for that. And on that note, it is time for me to call upon Dr. Davila to give her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. As of 12:30 this afternoon, there are 2,543 cases of COVID-19 in Toronto. This includes 2,257 confirmed cases and 286 probable cases. There are 223 people hospitalized, 90 of whom are in intensive care units. There are also currently 38 active outbreaks in our long-term care homes and 14 in local retirement homes. I'm sad to report that there have been 68 confirmed COVID-19 deaths in our long-term care homes and 1 confirmed COVID-19 death in a local retirement home. In total, 115 people have died of COVID-19 in our community. And I ask that you please join me in offering our condolences to everyone in our community who has lost a loved one to COVID-19 during this very difficult time. While I appreciate the desire to know details about individual cases and individual situations, our focus needs to be on managing our local outbreak response and protecting the privacy of these individuals and their families during this difficult time. It's with this in mind that at this time, we are not providing detailed data on cases per facility or long-term care home. These numbers are constantly changing as situations evolve, often many times daily. I've received many questions about long-term care and our role at public health in keeping their residents safe during this pandemic. I'm truly concerned about the devastating impacts of COVID-19 that we are seeing in our long-term care homes, and these are affecting our loved ones in the community. Given the complexity of the long-term care sector, I do think it's worth a quick overview to explain how this system operates, at least at a very high level. Long-term care homes are part of the province's healthcare system. In order to qualify to live in a long-term care home, residents must have significant health needs and require help with most daily activities. This means that residents of our long-term care homes are amongst the most frail and vulnerable in our community. In Ontario, the Ministry of Long-Term Care regulates, inspects, and sets out accommodation fees for all long-term care homes. And long-term care homes are either managed or operated by the municipality, the private sector, or a not-for-profit organization. In Toronto, we have 10 long-term care homes that are operated by the city and many others that are run by private and not-for-profit operators. The health and safety of the home's residents falls under the purview of the home and its management team. My team at Toronto Public Health works closely with all long-term care and retirement homes in the city to implement infection prevention and control best practices to proactively prevent and control outbreaks. Under the Provincial Health Protection and Promotion Act, all licensed healthcare institutions, including long-term care homes and retirement homes, are required to report outbreaks to their local public health department. We at Local Public Health investigate all reports of suspected and confirmed outbreak and assist facilities in implementing appropriate infection control measures to diminish the severity and the length of any outbreak or infectious disease that they experience. COVID-19 is also a reportable disease under the Health Protection and Promotion Act, so individual lab-confirmed cases are also specifically reportable to local public health. For COVID-19, we have been working with long-term care and retirement homes to implement a number of infection prevention and outbreak measures that include the following: initiating twice-a-day screening of residents and staff to monitor for COVID-19 symptoms and catch new infections as early as possible, implementing physical distancing measures and canceling all group activities, enhancing cleaning, particularly for frequently touched surfaces, ensuring that personal protective equipment is used appropriately to minimize health risks. In addition, on March 22nd, a provincial directive for long-term care homes from the Provincial Chief Medical Officer of Health advised all long-term care homes in Ontario that wherever possible, employers should work with employees to limit the number of work locations that employees are working at to minimize the risk of patients for exposure to COVID-19. It's my understanding that this will be further strengthened in the form of an order as announced today by the Premier. With respect to homes within the city, staff working at any of the 10 long-term care homes run by the city have been asked to choose the city as their primary employer, thus limiting work locations amongst staff and minimizing the risk of exposure to COVID-19 in the city-run homes. To make this an easier choice for employees, the city has offered additional hours of work and overtime, amongst other benefits. The staff working in long-term care homes are critical to keeping our loved ones safe. To do this, they need to stay healthy. We need to protect them, and our best line of defense is to reduce community transmission. This means staying at home as much as possible, and when you do go out, practicing physical distancing. Lastly, I wanted to share that the Ministry of Health recently expanded the COVID-19 test criteria for long-term care homes to increase testing during outbreaks. This will mean inevitably that our COVID-19 numbers within long-term care homes will go up. And while this may appear to be concerning, it is a good thing because it helps us to identify COVID-19 cases earlier, and it helps us to better guide our outbreak control measures in these vulnerable settings. So in closing, I would like to take this opportunity to thank each and every person working in any long-term care home or retirement home caring for our loved ones. They are responding courageously during this unprecedented time, and they deserve our respect, our support, and our gratitude. We all have an important role to play in protecting ourselves, our loved ones, and our community from COVID-19. I sincerely thank everyone who is adhering to our physical distancing recommendations at this critical time. Please stay home, stay safe, and take care of each other. I'll now turn it over to Chief Pegg.
Thank you, Dr. Davila, and good afternoon. One of the top priorities within the Emergency Operations Center is the management of personal protective equipment, or PPE for short. Today, I will provide you with a detailed PPE update and provide you with our current and projected PPE needs and inventory levels. There are 5 key articles of personal protective equipment that are primary in responding to COVID-19: surgical masks, N95 respirators, isolation gowns, face shields, and medical gloves. Although the supply of medical gloves is not an issue, as inventory and availability remain constant. Developing accurate and timely projections relating to PPE continues to be a challenge as these needs and demands change on a day-to-day basis. Our Emergency Operations Center coordinates PPE on a city-wide basis, including for first responders, for city-operated shelters and long-term care homes, and for each of the city agencies. The following are the citywide daily PPE consumption rates as of today. 1,695 respirators are used per day. 23,560 surgical masks are used per day. 17,500 isolation gowns per day, and 2,820 face shields per day. The majority of the N95 respirators are used by our first responders in the pre-hospital setting. The majority of the surgical masks, isolation gowns, and face shields are used within our long-term care homes and shelters, although these items are also used by our first responders. As I explained last week, our Emergency Operations Center has been working hard on the development of worst-case scenario plans on a number of fronts. With respect to PPE, the worst-case scenario refers to a situation where each city-owned long-term care and shelter facility were to be in full COVID-19 outbreak mode, and where community spread of COVID-19 is driving high pre-hospital care emergency response volumes. We have calculated the worst-case scenario with respect to PPE consumption in Toronto as follows. We would require 5,140 N95 respirators per day, 49,800 surgical masks per day, 48,000 isolation gowns, and 9,400 face shields per day. Our current PPE inventory levels are as follows. N95 respirators. We have 107 days of inventory at today's consumption rate, and 33 days inventory under the worst-case scenario consumption rate. For surgical masks, we have 52 days of inventory at today's consumption rate and 25 days at worst-case scenario. For isolation gowns, we have 51 days of inventory at today's consumption rate and 18 days at worst-case scenario. And for face shields, we have 26 days of inventory at today's consumption rate and 8 days at worst case scenario. The city's chief financial officer is directly connected with the province of Ontario with respect to the PPE supply chain and sourcing these items. As we have discussed before, the availability of quality PPE continues to be a very real global challenge, and we are continuing to work with our provincial partners to ensure that our PPE needs continue to be met. In closing, I would like to thank each of our city partners who are working non-stop on the ever-changing issue of PPE management and procurement. I appreciate that I have shared a considerable amount of data with you today, and remind you that my daily remarks can be found at toronto.ca/COVID-19 should you wish to access them that way. Thank you.
Thank you, Chief. We'll now go to questions. A reminder to limit your questions to 2 each. We'll start with Brian Passafium from the Toronto Sun. Brian, go ahead.
Good afternoon. My first question is for the mayor. You've been focused a lot on enforcement of social distancing in city parks. Why has not more attention been paid to the tragedy unfolding in the city's long-term care homes and homeless shelters, which are both accidents waiting to happen?
We have spent an immense amount of time in our emergency meetings. It's something that we have obviously talked about as events have unfolded, but I think in terms of the time, and I've said this many times publicly, the time that is spent and the priority that is given to issues of how we address the needs and the trials facing our most vulnerable populations, including the elderly in long-term care and outside, and including the homeless population, has been way in excess of what has been talked about, including on the enforcement issue. So I'm confident that every single day, and I mentioned that in my remarks today, I've asked the question, is there more we could be doing as a city, both with respect to our own long-term care homes and those that we don't have direct responsibility for? And we've had that discussion every single day, and never has there been an answer that says, well, yes, there's 4 more things we should be doing or could be doing that we weren't doing. But we've had the discussion constantly, and it's been a source of very acute attention.
Okay, thanks. My follow-up is for Dr. Davila. Can you explain exactly why not providing specifics on outbreaks of a reportable illness like COVID-19 at city long-term care homes is a privacy issue?
Well, I think there are a number of issues involved in reporting out on what's happening in specific long-term care homes. There are certainly privacy concerns. We do try to, at the end of the day, we're talking about people and their homes, and the residents within those homes are loved ones and members of our community. So we do, some of them are sick with COVID-19 and seeking to recover. So we try to give them the space in order to allow for that fulsome recovery. I think the other important issue, though, when it comes to long-term care homes and the situation that we're seeing, whether we're talking about city-run homes or those operated and run by other agencies and operators, is that the situation is changing very rapidly. So we are there as local public health to support long-term care homes, both in terms of preventing outbreaks and in managing outbreaks once they happen. However, if you want to understand and have the most up-to-date numbers around what's happening in a specific home, the best thing to do is to connect with the home directly. I think the other point that's worth mentioning at this stage of the game is when we're talking about the data that we get as local public health, whether it has to do with deaths related to COVID-19 or any other outbreak, it does take time for specific causes of death to be determined. And so we wait in order to get most confirmed data, the clear sense as to whether a given death that occurs in a home at a given time is related to an outbreak or whether in fact it's related to something else. If you're interested, however, in what's happening sort of the minute at a home, the best place to get that information is directly through the home.
Okay, thank you. We'll go to James Moore now from News Talk 1010. Go ahead, James.
Hi, good afternoon. We've been hearing from civil liberties advocates today have some criticism for cities, Toronto included, for giving more powers of enforcement to bylaw officers and sort of expanding what they're responsible for. For the mayor, where do you think the line is of balancing the need for more enforcement and surveillance to protect the community from the virus versus the need to preserve people's freedoms?
I think we've tried to stay on the right side of that line in the context that I think you always want to, make sure that you preserve people's basic freedoms in our country. But at the same time, we're facing a very serious threat to people's lives here, to people's health, and to the very way of life in our city. And I think you won't be surprised to know that I checked with our lawyers in putting the bylaw together as to its legality. Nothing is assured in these kinds of things when it comes to the law and the charter, but they informed me that they felt in this case that what we were doing here was consistent with reasonable, restraints on people's conduct in the cause of making sure that we saved lives here. That's been the priority, is saving lives, and I think most people, have found it actually quite straightforward to follow something that has been consistent health advice given, namely that they should space themselves 2 meters away from other people to stop the spread of this virus. So I think that we've achieved the right balance, and I think most people are satisfied with that out there in the public and would see this as a reasonable and temporary change to their way of life to save lives.
Just as a follow-up to that, what would you have to say to people who are concerned about any expanded powers given to authorities, at least at the city level, about those powers not being rolled back once the pandemic eventually passes?
I will say by definition, the bylaw that I signed and that has given certain additional enforcement powers to bylaw and police officers with respect to how people distance themselves from one another in public spaces is something that will expire automatically because of the emergency provisions and how those work. I would say to others who are not satisfied with powers that our authorities have or with laws that are passed, that is why we have a Charter of Rights, that is why we have a court system, and that while we're trying all the time to make sure that we stay on the right side of that line in favor of preserving and protecting people's rights, we also have an obligation to protect their health and to keep people alive. But those who are not satisfied we've done that right can seek redress in the courts.
Okay, thank you. We go to Dave Ryder from the Toronto Star. Go ahead, Dave.
Hi, Mayor Tory. I understand this morning you talked about having a meeting or a briefing at noon, and I believe it was focused on kind of economic recovery or how the city gets back into operation once the worst of this crisis is over. Can you give us an update on what happened there and where we're going on that?
What we have is a group we put together from the beginning. I think it was called the Mayor's Task Force on Recovery, and it has a number of councillors involved in it, and in turn they're working with people in the community and in the public service to make sure the city is ready, that we've done all the planning we have to do to make sure the city government can get back in operation as quickly as possible, because it serves the needs of many people who are out there in business with permitting and this kind of thing. We've also talked about putting a plan together, which I've mentioned before, and we were talking actively about that today. That is kind of an open for business. I don't want to call it a celebration because we're not in the mood for that at the moment, although maybe some people are, but an open for business series of events involving the main streets that I talked about, the small businesses, the restaurants, the bars, getting people to go back to doing some of those things. But we also talked about the fact that all of this is going to have to be governed by the public health considerations, because I've said repeatedly, and I think Dr. Davila has said as well, it's not going to be as if there arrives a day, hopefully as soon as possible, but any day where all of a sudden we go right back to the way everything was before. So we've also talked about how you could phase this in such a way that takes account of what the public health requirements are, but at the same time gets the city back into a way of life that we're more familiar with on whatever gradual basis. So those plans are being put together. I think they're going to be robust. I think they're going to be complete in the context of looking at every neighborhood, every kind of business, every kind of organization, all the things that go with that, and we will be endeavoring to have those ready by the anticipated time that we were told might have them be useful to us, which was at the end of that 12-week period that was talked about. But that's up to, again, how things unfold in terms of people's state of health in the city.
Thank you. And follow-up question for Dr. Davila. I'd read before that when there's a certain amount of community spread, you don't need to do contact tracing because it's out in the community and it's kind of the horse is out of the barn. But I understand Toronto Public Health is still doing vigorous community tracing. I was hoping you could tell me where we're at, I assume that means that the community spread isn't so much that we would just stop that and divert those people to something else?
So it's an interesting question that you ask, and you're quite right. With most pandemic-type scenarios, the traditional public health approach has been that you do a certain amount of case and contact tracing until it reaches a certain level, at which point you start to rely more on what we now know as public health measures, and we've all become quite familiar with these public health measures, things like physical distancing and that kind of thing. However, this is a new virus. And there's a lot of learning still proceeding in respect of how to manage this new virus. And what we have seen when we look at other jurisdictions that have been relatively successful in terms of managing their own outbreaks and their own experiences has shown us that, in fact, testing throughout and case and contact tracing and continuing on that case and contact tracing work that is fundamental to public health has been part of the response for those jurisdictions that have had the greatest success. So not unique to Toronto, certainly not unique in the province. I know that our colleagues around the province of Ontario are still also actively engaged in case and contact tracing, and that has been what we have learned from other jurisdictions that have been relatively more successful with their outbreak response. So we're trying to put those good lessons to good use.
Okay, thank you. We'll go to Scott Lightfoot from CTV News. Go ahead, Scott.
Thanks, Brad. Question for Chief Pegg and Dr. Davila, and thank you for the update on the PPE. You walked us through sort of the current stockpile and usage. Just wondering from both of you, do you have any specific concerns here, either on specific items or specific institutions like long-term cares or shelters, considering that this pandemic could continue for some time and perhaps past what you have in stock now?
Sure, I'll start. We monitor, the EOC is monitoring and managing PPE literally around the clock, 24 hours a day, 7 days a week. So something that we are continuously monitoring. Like I said in my remarks, it's a challenging thing to manage and to monitor because it changes hour to hour. As the COVID situation in the community changes, there's a direct and almost automatic corresponding change with respect to PPE. So we're monitoring. Like I said, the numbers I gave you, would we like to see increased levels? Of course I would, but I'm very confident. If you go all the way back, we started proactively planning for this eventuality before the first case was ever in Toronto and candidly before it was ever in Canada. And as a result, we have robust plans in place. We have robust PPE management methodologies in place, and our team is doing a fantastic job. So from my perspective, we are in a good place. We're working in collaboration with the province, and I'm confident that we actually saw some good news coming out of the Government of Canada today with respect to PPE delivery. So as long as our colleagues at the provincial level and the federal level can keep the supply chain open, we'll continue to manage on our end, and I'm confident that our frontline workers will have what they need.
Yeah, I think if I were to add anything further to that, as it's as important as personal protective equipment is, particularly in the context of outbreak and protecting everybody in an outbreak situation, there are other measures that also need to be adhered to. So it is one piece of the puzzle, and it is an important piece, but it is just that, it's one piece, and I think we have to look at the sum totality of all the different measures that need to be put into place in order to best protect those who need to be protected particularly in vulnerable settings.
And follow-up to the mayor, the city has been doing flu pandemic planning since SARS. Obviously, the scale here is much larger than SARS, and there's not much that can be done on what happened in the past when it came to planning. But what do you think the city has to do in terms of planning going forward? A lot of the things that are being enacted now are sort of being done on the fly. We've heard this could come in waves. Even after people are sort of released back into the wild, there may be future lockdowns. So what does the city have to do going forward to deal with this the next time?
I think we're going to have to do a complete re-examination of this. Everyone is different. SARS affected a much smaller number of people. When you look at it, there were far too many deaths, of course, but it affected overall a far smaller group of people compared to this one and compared to the risk represented by this one, which also is something that is in the realm of the unknown in many respects. So we talked this morning, for example, about the fact that your experience in dealing with the PPE requirements of this particular pandemic, if you assume there might be another one, obviously would lead you to do some things differently with respect to inventory levels, albeit that the inventory has an expiry date on it. So you have to be careful about sort of how you stock up depending on when you think the next pandemic might come. So I just will say that I'm sure that after this is over, all of us at each of the different orders of government will undertake a review of all the different experiences we had and the things that we found that weren't to our satisfaction, because there are always things like that in any planning that you do. And that is something where I think we're taking careful notes as we go along to make sure that we're ready for a second wave that gets talked about, but also for another episode of this kind, and you can always learn from your experiences.
Okay, thank you. We'll go to Francine Copen from the Toronto Star. Go ahead, Francine.
Oh, hi, good afternoon. My questions are for Dr. Davila. Earlier this afternoon, we learned that there are 30 COVID-19 cases in 7 shelters in the city. I wondered if you could tell me how many of those 7 shelters are experiencing what you would define as an outbreak, which I think is it more than one case?
So yes, within most congregate settings, save and exclude for long-term care and retirement homes, it's generally considered 2 cases. So I don't have the specific details on a shelter-by-shelter basis. I can tell you that we have active investigations ongoing at 3 different locations, the Willowdale Welcome Center, and I will give you the other 2. Seton House, and if I've got it right, yes, Dixon Hall on Lakeshore. So that's where we actually have active investigations ongoing. When I talked about the number of cases spread out over the different shelter settings, some of those actually refer to cases that have resolved in investigations that have been wrapped up, thankfully. So in terms of active investigations, we have 3 on the go right now.
And what is meant by an active investigation? What are you doing as part of an active investigation?
So what that refers to is that there are cases there at this point in time and outbreak measures that are in place. So infection prevention and control and outbreak measures to understand you've got cases, you've got contacts that are happening, so those are actively being followed up to determine exposure sites for the original cases and who in turn they may have exposed to, who are the close contacts that then need to be watched carefully in order to try to limit spread. So that's the case and contact aspect of the investigation. And then, of course, there are other measures that need to be put in place in order to limit spread. So everything from enhanced cleaning to more active screening to determine whether new people, staff or residents, are developing symptoms. So that kind of thing is what's happening.
Okay, thank you. We go to Jeff Gray now from the Globe and Mail. Jeff?
Oh, hi. Just following up on that. We can't get a breakdown of how many cases we're talking about at those 3 shelters. Could you tell us how many cases have resolved of the 30?
Unfortunately, I don't have those details in front of me at this moment, but I would be very happy to follow up.
All right, I'll cede the floor to my colleagues. Thank you.
Okay, thanks, Jeff. Go to Kate Allen now from the Toronto Star. Go ahead, Kate.
Hi, this is a question for Dr. Davila. We saw this big jump in deaths at Eatonville, and I'm wondering how much of that came from testing that was done post-mortem. And given that testing capacity was constrained in long-term care homes until recently, are there other deaths that have occurred in nursing homes that are being re-examined or potentially tested?
So with all deaths within the context of long-term care homes, actually with all deaths that occur within the context of the province, there is always a process by which the cause of death is determined, and it actually has to be completed as part of the death certificate. That process sometimes takes some time to complete. In some situations, it's fairly obvious and it doesn't take a particularly lengthy investigation in order to understand what the cause of death is. In other circumstances, there may be multiple health issues that are at play. And again, there may be, say for example, in the case of a long-term care home, there may be a concurrent outbreak at the same time. So the determination as to the cause of death in that sort of situation may in fact take several days. So I can't speak to, whether in one particular or what the deaths and testing in one particular home may have led to an increase in the numbers overall. But just to give you a sense as to how deaths are reported, it does take some time, depending on what the circumstances are, before you actually know in every case what is the cause of death. So sometimes delays or jumps up in numbers have to do with reporting. Other times, it may be other circumstances and other situations. I think each one has to be looked at on its own.
So I guess my follow-up then would be, you warned that the increased availability of testing in long-term care homes might lead to a jump in cases in these settings, which would actually be a good thing because we know more realistically what's happening there. Should we also expect a jump in deaths? So deaths that have already occurred that may now be attributed to COVID-19 because testing is more available. Does that make sense?
Yes, I understand, and that certainly is a possibility. I think, however, the important point here is that we know that the residents within long-term care settings tend to be older, tend to have pre-existing health conditions, chronic health conditions, and tend to have compromised immune systems. So first and foremost, what we're trying to do within the realm of long-term care, and this is public health working in partnership with staff at long-term care homes, is to ensure that they're practicing the best possible infection prevention and control. The best answer, the best way to protect residents within long-term care settings is to prevent the infection from happening in the first place. And that's because we know once COVID-19 enters into a long-term care setting, you have a vulnerable population who's very sensitive to negative outcomes associated with COVID-19 infection, and it is difficult to control spread of infectious disease within a congregate setting, particularly a congregate setting that has residents that are vulnerable to COVID-19. So really what we try to focus on is on prevention as much as possible, and the best way to help us manage outbreak measures and to identify and direct public health actions is to understand what the situation is in the home. That's why I'm a strong advocate for testing as much as possible. It gives us data that helps us to understand where we are, whether it's a long-term care home or another setting, and it helps us guide our actions in the most informed way and allows us to identify cases as early as possible so that those very strict control measures, which we've seen work, can actually be put into place as early as possible.
Okay, thank you. We'll go to Matt Bingley now from Global News. Go ahead, Matt.
Hi, Dr. Davila. I've been speaking with a person who has a loved one in a long-term care home, and she's finding it quite alarming, the fact that she's having difficulty not being able to get information about what the case count is within that home. And I'm, based on what happened in Quebec, I know a lot of other people are concerned about that as well. So just with the interest of trying to stay forthcoming with information to them, why not post the breakdown for those locations so they can know what's going on?
So Matt, thanks for the question. And, first of all, let me express, my shared concern with those who are finding challenges getting information around their loved ones in these homes. I mean, we know that families put their loved ones or place their loved ones in long-term care homes because they have very specific needs that cannot be readily addressed within your standard home, home in the community sort of setting. They need the specialized care and the specialized services in long-term care, and that's why people put their families in long-term care homes. So I certainly appreciate and understand concerns for family members who are having a hard time getting information. I think what I can tell you is that from a public health perspective, we are trying to manage as best as possible with long-term care partners the many outbreaks that are happening with a new virus that we're all actively learning about. Again, a virus discovered in January. I realize it's now April, but we are still very much learning how this virus progresses through a community. There are lots of papers and scientific studies to help us better understand the nature of the virus so that we can direct our response appropriately. So what that means from a public health perspective is that we are focused very much on the outbreak response and trying to support our long-term care partners to provide the best environments for the residents that they're taking care of. And the challenge is in those environments that it is changing so rapidly, literally many, many times a day. So I think this is a challenge not just for us as the support to long-term care home, but from what I can gather, it is a significant challenge to those who are actually trying to provide care in those settings to the residents that they have. Tracking the numbers that are constantly changing while trying to provide care and maintain strict outbreak control measures is a Herculean task. So I don't think that there is any real effort or intent by long-term care providers, and certainly not by public health, to not be forthcoming with numbers. I think there are just challenges for many of us in terms of trying to ensure that we're doing the best we can by the residents in those settings, while at the same time providing information as fulsomely as we can.
Just my second question had to deal with the homeless population. You've taken us through how many positive cases there are. Can you tell us how many probable cases are within the homeless community?
So I don't have those figures with me now. I can certainly ask the data team back at Public Health and perhaps consult with my colleagues in the shelter system to see what we can provide you.
Thank you.
Okay, last question is to Derek Dionarian from the CBC. Go ahead, Derek.
No worries. Thanks so much, Brad. I just wanted to talk to Mayor Tory first. So you touched on earlier that there are plans developing as to how the city may eventually reopen. Is the city reopening going to be a gradual process, and what would be one of the first things to open?
Well, we haven't determined any of that. That's going to largely come from the advice received from our medical officer of health, because of course our continuing preoccupation, yes, has to be to get the economy open, get people back to work, get as normal a way of life reestablished as possible, but do it within the context of keeping people healthy and making sure that we manage something that won't just go away overnight, and where they've told us very clearly there is the possibility of a second wave, for example. So the gradual part just comes from, I think, what every single jurisdiction in the world, and we're spending quite a bit of time looking at what other cities are doing that are a bit ahead of us in time, and I haven't heard anybody talking about flipping a switch and one day everything goes back to the way it was. So we're making the plans on the basis that, and with the advice of the medical officer of health and Toronto Public Health, so that we can have some determination as to how we can actually have different segments open up. And you've got to then take into account things like the need for public transit to return to normal and all kinds of, I'll call them infrastructure considerations. So we're looking at a wide range of things, trying to map out a framework, have it ready, and also have this other part ready that kind of has us declare ourselves open for business and get back to within the constraints that I mentioned, but get back to something that approaches normalcy in the context of the economy and people's livelihood and their way of life.
Certainly, and just to follow up this last question for Dr. Davila, from a public health standpoint, what will the new normal look like in a case where the city eventually does reopen?
So that's an excellent question, and as I think the mayor was just trying to address, we are still very much trying to figure that out ourselves. We know that there are other jurisdictions who are a little ahead of us in respect of the outbreak, and they are still asking those questions themselves as well. So I can assure you this is a very active conversation, I would say, amongst municipal officials and certainly amongst public health officials to try to determine how best we restart or reopen different activities within the city in a manner that supports the health for all, not just from COVID-19, but all the aspects of life that actually contribute to health, which includes, the social life, civic life, economics, etc.
Okay, thanks very much for joining, everybody. We'll talk to you again tomorrow at 3:45.